Well, finding good health care can be tough, especially living in rural communities. But now Wellstar is working to bridge that divide through 24/7 telehealth support. Here now is Dr. Matt Lyon, Director of Wellstar Center for Digital Health. Welcome to the show, Matt.
Thank you so much, Chesley.
All right, how does this digital network work?
So we've been doing this for several years where we connect academic and Wellstar resources, specialty physicians and those kind of things to rural hospitals. In rural Georgia, there's a lack of physician resources and a lack of access to specialists. And so by using digital health, we're able to connect those specialists without the needing to drive to those places, which then really allows us to expand our workforce to meet the needs of rural Georgia.
Gotcha. So walk us through what happens when a patient is in a rural ER, right, and suddenly needs a specialist. What happens?
Absolutely. So there, you're still relying on the local healthcare system. So the doctors, nurses, clinicians there, they identify that a patient has a need for something that they can't provide locally, whether that's infectious disease or a cardiologist or pulmonologist. And so they initiate a telemedicine or a digital health consult where they notify us that they have a need. We, just like we're doing right now, we get on the TV, so to speak, and we're able to beam into that hospital. We're able to then work with that clinician to do a physical exam and the lab testing necessary to make a diagnosis, and then give expert advice about how to treat that patient. Sometimes that means that the patient has to leave their rural community to come to Wellstar to get that treatment. And most of the time, though, it means that they can actually stay in their rural community. We've treated over 5,000 patients in the last couple of years in rural Georgia, and over 75% of them have been able to remain in their rural hospital.
Gotcha. Matt, we've been seeing a lot of rural hospitals closing down or hanging on by a thread. How does this network help them to stay open?
Oh, that's such a fantastic question. Yes, it does. So the way it works is if you don't have access to specialists, you oftentimes are transferred out of a rural community because there's a fear of disease. And when you're able to tie in that specialist to the rural community and you can assure that local clinician that that need is not there for that patient, or it can be handled in a less urgent fashion, like as an outpatient, then that patient can stay in the rural community. What that means, though, for the rural community hospital is that they have more patients to submit bills on to Medicare and Medicaid. That means they have more money coming into their hospital, which makes them more financially viable.
So if this didn't exist, then that hospital could be in trouble.
Yeah, absolutely. The hospital we talk about in situations like this is Candler County Hospital, which is in Metter, Georgia. Back in 2018, when the governor surveyed the rural hospitals, that was number 2 on the closure list, risk of closure list. And bringing in digital health connectivity like this over the last several years, they've gone from having 2 patients on average in their 25-bed hospital to now being full, having a full 25 beds full. And what that means is they have more revenue, they have more ability to invest in themselves, and now they're actually even looking to expand. So it is a great turnaround story for our rural Georgia hospitals.
Matt, are you seeing the need specific in these rural areas, or is it just a wide range of things that you need to provide for them?
Well, it really, to be a good provider, a good digital connectivity partner, you really need to be able to offer a very broad range of services, from pediatric to geriatric, from OB to surgery. And so that's what we do. We tie in all manner of specialists and clinicians so that that patient's getting the right care and the right advice in their community hospital.
Okay, Matt Lyon, thanks so much for joining us. Really appreciate that. Some good news there.
Thank you so much.
All right.